Good morning. My name is Febanish. I am your nurse today. I have an order to check your head to toe assessment. Are you okay to do that?
Yes.
Okay. I am washing my hands and I am providing my client privacy. The purpose of this assessment to know whether you have any problem with your body function and it is functioning normal or not. And so I am going to assess your body systems. Okay. Can you show me your identification then? Okay. What's your name and date of birth?
Jason Pulitra Stephen, 8 December 1998.
Okay, I'm verifying that with the patient chart, patient name and date of birth, and it matches. Okay, do you have any pain?
Yes.
Okay, where it is located?
Leg.
Okay, is there any factor that your pain could worsen or make feel better?
Long standing make it worse.
Okay, what is the quality of your pain? Is it is dull, stabbing or throbbing?
Stabbing.
Okay, is it radiate anywhere else in your body?
No.
Okay. Could you rate your pain according to the pain scale? 0 means there is no pain and 10 is worst.
2.
Okay. Then when did it started?
Yesterday.
Okay. What do you think the pain is from where?
Maybe I'm standing long hours in workplace.
Okay. Then I'm going to move on your neurological assessment. For that I'm going to check your level of consciousness. What's your name?
My name is Jason Pulitra Stephen.
Okay. Where are you now?
At home.
Okay. What year we are in?
2023.
Okay, I am going to assess your cranial nerves. You are oriented to person, place and time. So your level of consciousness is normal. Now I am going to assess your cranial nerves 3, 4, 6 and 7. 3 is oculomotor, 4 is trochlear, 6 is transducens, abducens and 7 is facial nerve. So first for that I am going to assess your perla and confrontation. Can you please stand for that? I'm just focusing the pen light on your pupils. You have to just look on my tip of the nose. Okay. Okay. Other side. Okay. Her pupil is equal round and it is reacting to light bilaterally. And now I am going to check the accommodation. For that you have to just check. Look at the tip of my fingers. I am just pointing towards you. Okay, her pupils are accommodating and it is converging bilaterally. So its accommodation is normal, she is accommodating. Now I am going to check the confrontation. For that you have to cover one eye at a time and bilaterally you have to do it. I will show some numbers on my fingers, you have to tell that.
2, 3, 2.
The other side.
2, 2, 2.
Okay. So your confrontation also is normal. Now I am going to check her facial nerves. Can you please sit? Okay, can you look up and eyebrows you have to put up. Okay, that is normal. Then can you just tightly close your eyes and show me your teeth and smile? Yeah. Yeah, her strength is normal and there is no facial twitching or no facial palsy or anything. So her facial nerves is normal and she is oriented to person, place and time and her pupils is equal, round and accommodating and reacting to the light confrontation is also normal and all of her cranial nerves that is working normal. So her neurological assessment is functioning well. Now I am going to move on her respiratory assessment. First I am going to do the inspection. Can you just come and lie down? I am going to check her chest symmetry. Okay, her chest is symmetrical bilaterally and can you come and sit here? I am going to check expansion and retraction of the chest wall. Okay, just checking. Okay, can you take a deep breath? Okay, once more. Okay, her chest is expansion and retraction is normal and her breathing is non-labored and her bilateral airway entry is normal. And I am going to assess her. I am going to do the auscultation. Okay, can you turn? Okay. Her lung sounds are normal. There is no adventitious breath sounds like stridor, ronge or wheezes or anything. So her lung expansion, retraction, everything is normal and breathing is non-labored and bilateral airway entry is equal. So I am going to move on her cardiac assessment. For the cardiac, I am going to auscultate her heart valves. That first one is aortic, that is in the second intercostal space on the right sternal border. Next is pulmonic, that is in the second intercostal space in the left sternal border, and the third is Erb's point, that is in the third intercostal space on the left sternal border, and the fourth is tricuspid, that is in the left sternal border, the fourth intercostal space, and the fifth is mitral valve, that is located on the fifth intercostal space on the mid-clavicular line. Now I am going to auscultate that. Aortic, that is in the second intercostal space on the right sternal border. Aortic, pulmonic, Erb's, tricuspid, mitral. I am going to assess her apical pulse for 30 seconds. Her apical pulse is 82 beats per minute and rhythm is regular, and I didn't heard any abnormal heart sounds like murmurs, so her cardiac system is functioning normally. Now I am going to check your abdomen. So I am going to do the abdominal assessment. When did you had your last urinated? When did you do
Today
that last?
morning.
Okay. When did you had your bowel movements?
Today morning.
Okay, so I'm going to do the inspection. Can you just come and lie down? So I want to check your corner of your abdomen. Okay, her abdominal corner is flat and symmetrical. So and the skin, I cannot see any lesions or bruises or wound or any discoloration. So now I'm going to auscultate her abdomen. Do you have any pain in the abdomen? First I am auscultating in the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. So in the same way I am going to palpate using the light palpation on all the four quadrants on the same way. Do you have any pain?
No.
If you feel any pain, you just tell me. Right lower, right upper, left upper, left lower. On palpation, I didn't feel any lumps or bumps or any protruded abdominal organs or any tenderness. Her abdominal assessment is normal, and there is no abnormal bowel sounds or anything. Her bowel function is normal. And can you come and sit so that I can go and check? I can check her both upper and lower extremities and skin. Okay, can you just show me on the inspection? I'm just checking. Do you have any pain on the upper and lower
No,
extremities? Okay, there is no pain, no edema, no pressure points, nothing. That everything is look normal. And can you just show me your fingers? Okay, her capillary refill is normal, and there is no discoloration or cyanosis on the nail buds. It's pink in color. Can you just I want to check, do you have any clubbing your fingers? Can you just do it like this? Okay, there is no clubbing of fingers. It's normal. And the down the lower extremity also, there is capillary filler less than 3 seconds. There is no brittle nails on the both fingers, no brittle nails, and no discoloration of the nail buds. Yeah, everything is looks normal. Then I'm going to check her skin turgor and integrity. Yeah, her skin turgor is normal on both extremities. Yeah, then the skin integrity is normal. Is there any lesions or bruises at back? It's everything, her skin looks normal. And now I'm going to check your circulation, warmth, and movement and sensation. Can you just move your hands or legs? Yeah, her movements is good. And now her body warmth is normal. It's normal temperature. There is no problem with that. And can you just close your eyes and tell, do you feel any sensation?
Yes. Yes.
Okay, now where I'm touching, you feel right?
Yeah, right leg,
Yeah.
left leg.
Okay, so her sensation is also normal. All the circulation also fine, because her temperature, warm temperature is normal, and her skin capillary refill time is normal. So her circulation, your circulation is fine. Now I'm going to check your muscle strength. For that, can you just give me a push? Yeah. Just can you just give me, pull me, and can you just use my hands? Okay, same way on the legs. Can you just put down? Okay, up. Okay, her muscle strength is bilaterally equal, and it is 5 by 5. And I am going to palpate your pulses. Okay, first a radial pulse. Yeah, that is bilaterally equal. Rhythm is regular. Strength is 2 plus. And dorsalis pedis, and rhythm is equal. Strength is 2 plus. Rhythm is regular. Strength is 2 plus, and it's regular. Bilaterally equal. Posterior tibial, that is also rhythm is regular. Strength is 2 plus and bilaterally equal. So all her upper and lower extremities functioning normally. I didn't find any abnormalities. And so I am just washing my hands and documenting it.